Today I'm talking to Brian Middleton, who is known as the bearded behaviorist on social media. Brian is an autistic individual. He's also a board certified behavior analyst with some expertise in ACT, acceptance and commitment therapy for kids. So today we're covering that topic. Hi, I'm Dr. Mary Barbera, autism mom, behavior analyst, and best-selling author. Each week, I provide you with some of my ideas about turning autism or signs of autism around. So if you haven't subscribed to my YouTube channel, you can do that now. So today, we're sharing a short excerpt from podcast 236 with Brian Middleton, who is an autistic BCBA, and we're talking about ACT for kids.
And a part of it is understanding that there's no such thing as a maladaptive behavior. There's no such thing as a maladaptive emotion. Now, are there complexities? Yes. Because I'm talking about these things, and even as I'm talking about these things, I'm going, this isn't easy. Mm-hmm. Like I've worked with some really hard cases, some really hard situations. In fact, one of the first people that I use ACT with is a adult with intellectual disability, non-vocal and autistic, who 2 weeks before I came onto his case, he broke the radial on somebody's skull, which is the bone that's right next to the eye, for those who don't know where that is. And that's a very bad place for a bone to be broken. Like, we're talking intense aggression, intense self-injury, public defecation, urination, elopement, property destruction, the whole 9 yards. And he was the first one to teach me how to use ACT for everyone, because as soon as I identified what he mattered to him, what his values were,
and his motivation, reinforcement, you know, and when you get, I mean, for every child, we need to really start with reinforcement, pairing, even with your baby daughter. You know, I'm going to change your diaper. Okay. Oh, you look like you have a belly ache, you know, because she's straining to poop or whatever. Being on it, like being like, maybe I need to keep track of her bowel movements, or like the whole sleep thing, you know, instead of like, I am not a fan, and I'm sure you're not a fan of cry it out. You know, if babies are crying or young kids are crying, you know, they probably need something, and there's probably some pain or distress or stress, or the demands are too high, reinforcement's too low. And it's our job as the parent or professionals to change that around. Whether we're going to call something ACT or ABA, I just believe that if we were a lot more positive, told kids and people what we were doing, being gentle, being positive, it just goes a long way.
Yeah. And well, and a part of, so here's a perspective for you. Optimism and pessimism are both based in the same concept. We ignore something about the environment. Because when you're optimistic, you're ignoring all the negatives. And when you're pessimistic, you're ignoring all the positives. We want realists. Okay, so being positive, yes, but also moving towards something, looking to find something. And that's really important when it comes to ACT, because the ACT concepts, except, let me see if I can find it. Here we go. Diffusion, that's the ability to learn how to take a step back from the experience that you're having. As a parent, if you haven't mastered that yet, you're definitely going to need to, right? I've been working on it a lot. Being present, that's being aware and engaged with what's happening right now. What is my attention focused on? Self as context, that's giving myself and others permission to be human. I want to say that again. It's giving myself and others permission to be human. Acceptance, that's learning how to non-judgmentally be aware of a situation. Okay. Committed action, that's moving towards values-informed goals. What am I doing? And then, of course, values are what's important to me. What is the purpose and direction I have? And that's hard for kids when it comes to values. That's actually where people get the most stuck, is values for kids, because, well, they're still learning their values. But here's the thing, there are universal values: safety, having fun, being connected, being included, having rest, having choice. These are all values, and you can start with universal values and follow the kid's lead. But I'll tell you right now, what are some other ways that you can figure out values? Look at what they're interested in. I use video games to figure out values for kids. Vocal, non-vocal, doesn't matter, because video games tell us a little bit about them. Kids who love Minecraft, depending on the type of way that they play Minecraft, they maybe love creativity, or maybe they love the challenge. What
We
about
just
kid?
did a podcast last week, 235, all about autism toys, and that our main population is kids that don't talk and or that aren't conversational, and looking at what they do when there's, nothing going on. Like, are they rocking? Are they stimming with their hands in front of their face? Looking for clues. What toys do they pick up? How do they play with those toys? Kind of just bringing your example back to younger and
Well, and I have actually a perfect example of how I found values with a kid who was started out completely non-vocal. And when I left the company, because I had to move on for professional reasons, opportunities. When I left the company, he was at stage 3 of Project Impact, where he started like using multi-word communication. And what I did with his play is I looked at what type of play he was doing. And there were 2 types of play that were real dead giveaways to me. The first type of play was the exploratory creative play. And that was where he was flipping water and marbles, and he was watching the light reflect off of them. And the other type of play that he did was the swinging, spinning type of play, where it was about getting that physical movement going. And I was able to figure out a couple of the core values for him, which value 1 was curiosity. He liked to explore. Okay, so I used that. And it took a lot of shaping, but I used that. And then the other one was movement. Movement is a value. He loved everything to do with moving. So guess what we didn't do? We didn't do DTT at a table all day. We did a lot of movement. Now, we did do DTT. I'm not saying DTT is bad. Like, anybody who tells you that something is bad just because.
We don't really,
discrete trial training, for those who don't know what that is.
Don't know what DTT is, because we use the Turn Autism Around approach, which is mixed, verbal behavior and early learner materials and all, and basically combining natural environment teaching with intensive teaching. And so, even when you're talking about Project Impact, and I'm sure it's great, it's, behavior analysts and
there's more than one right way of doing it. I'm not saying that Project Impact is.
Like when I hear Project Impact and it's combined and whatever, I'm thinking I probably have the basics of what Project Impact is in my Turn Autism Around book, in my online course, and we're not here to like say, you need to use this approach. Basically, whatever approach you're using needs to be positive. We need to be gentle. We need to not use cry it out. We don't ever, I'm a big proponent on table time, but it's not the kind of table time that you and I have seen in the past. It's not ever forcing a child. We want to have the reinforcers at the table. We want to, so I think ACT for kids is more like, if the children don't have language, we need to provide all that positivity, gentle, talking about emotions. But I'm a registered nurse too, and people all the time, like, how do you get kids to tell you they're in pain? Well, there's labeling their pain, but there's also some body part work, potato head, magnadoodle, that we can teach kids body parts, because I don't care how old you are or how vocal you are. If you can't touch or label body parts, it's going to be really hard for you to indicate when you're in pain. So those kind of things. I know you mentioned to me before we hit record. I hope you enjoyed that short excerpt. If you did, I would love a comment or a thumbs up, or share it with somebody who might benefit. And for more information about how you can take a free online workshop to see if our online courses and approach are right for you, you can attend a free workshop at marybarbera.com/workshop. And I'll see you right here next time.